have a story. The poster boy for this, for me, was a guy he was a marathon runner. Very healthy guy. His only risk factor was that he was a guy. No past medical history, no family history, no nothing. So he came to see me for the first time, and I thought, oh boy, so we're going to put you on a treadmill, and I'm going to need to call the company to service the treadmill because you're going to wear it out.
Break it out, yeah.
And he about did.
Wow.
So he got on that treadmill. I needed to get a sandwich because he was on that treadmill a long time. 18 minutes into his treadmill test, which nobody goes 18 minutes.
Wow.
Nobody. He said, yeah, I'm starting to get that discomfort. You look at his EKG and it's like, you look like you're going to die.
Wow.
So we stopped this thing. I take him to do a heart catheterization. He needed bypass surgery. No risk factors.
What?
We call them risk factors, and that's what they are. They're not causes.
You'd be surprised how often this phenomenon occurs. So many heart conditions that Americans struggle with. Congestive heart failure, coronary artery disease. In this Charlin Care Pods episode, Dr. Rick Ammar is going to go through the top 3 diseases that we see a lot in the healthcare industry. Let's go.
That's awesome. Now, so I had two questions. I wanted us to kind of focus in on diagnoses.
Okay.
Right? So we talked a little bit about the different valves, atrium, ventricles, and how that plays into the fact of how the blood's flowing. CHF, if you could kind of give a very basic rundown of what congestive heart failure is.
Sure. So congestive heart failure is not actually a diagnosis. It is a syndrome.
Nice.
So it is the syndrome that is present when a person has accumulated extra fluid in their body. So that typically presents with shortness of breath. Sometimes your belly feels full, swelling in the legs, difficulty walking, you can't lay flat because you get short of breath. And your organs are actually relatively underperfused, so they can actually not function as well. That syndrome is most commonly present because the main pumping chamber of the heart, the left ventricle, is weak. It doesn't have to be that. So there's both the squeezing of the heart and the relaxation of the heart require energy. So the squeezing of the heart, traditionally people think congestive heart failure, they think that that's weak. Half of heart failure is not because of weak hearts. It's because the heart doesn't relax properly.
Wow.
So let's talk about how that could actually cause congestion and fluid. So if you blow up a latex balloon, you blow in, the balloon gets bigger. If you hook up a straw to a truck tire, you can blow until you're blue in the face, and the truck tire is not going to change.
Right.
So the latex balloon is compliant, and the truck tire is not. So if the heart is not compliant, it needs to fill up with blood in order to have something to pump.
Yes, yeah.
And if it requires more pressure to do so because it's stiff or non-compliant, then that pressure will actually back up into the lungs.
Gotcha.
So both
Fluid,
a weak heart and a stiff heart can cause heart failure.
Wow.
The weak heart, so if the body needs a certain amount of blood flow, and so the heart has a certain volume, it's going to pump out so many times a minute, 60, 80 times a minute, and it's got to, if the heart is weak and can only pump a certain percentage of the blood out with each heartbeat, one way it compensates for that is to get bigger. So there's more blood there, and that is take a small percentage, but it makes up for lost time and what can pump out that volume that the body needs. But that dilatation causes elevated pressures and backup of blood into the lungs and legs and all this. And as the kidneys get poorer blood flow because of heart failure, they will not filter as much fluid out, so you end up and that's actually survival mechanism. So if the kidneys think the blood flow is low, sort of, if you believe in an evolutionary thought process, in the days of saber-toothed tigers, it could have meant that your leg was off. So if you were bleeding to death and the kidneys didn't see the same blood volume,
hold up,
so we better retain all the salt and water we can. That's exactly right.
Yeah.
So that is so there's different things that happen as a result of the heart not functioning properly that cause fluid to build up in your lungs and your legs, and you to feel crummy, and tissues not to be well perfused.
Wow.
So that is the syndrome of heart failure. It can actually also happen because your kidneys don't work at all. So if your kidneys aren't functioning properly, you're going to accumulate fluid because you can't get rid of it.
Yeah.
You can have heart failure symptoms related to lung disease alone. So fluid can build up in your legs, all this. It can happen because of a heart rhythm abnormality. So your heart, in order to pump blood out, it has to have blood to pump. And if your heart's going really, really fast, it doesn't have a chance to fill up. So it's just pumping the same, a small amount of blood, and it'll cause the same thing.
Wow.
A heart valve that is too sticky to let, if it just barely is opening, that pressure is going to back up. And there's a number of things that can cause the syndrome that we refer to as congestive heart failure.
So you're looking at so many different areas to see, okay, what is causing this syndrome?
Bingo.
And then now applying, and now we're talking about, like we were talking about earlier, different types of new medications.
Yes.
Those medications are pinpointing what specifically when we're talking about.
So there's different things. So let's go to the most commonly thought or most commonly considered congestive heart failure, and that's that the heart's weak. So back in the old days, really all you could do about that was to give people diuretics to get rid of there were ones before furosemide.
Oh yeah, right. Really?
I am that old. So, but you would make people just basically urinate out the extra fluid, and that was kind of all you had. That was the arrow in your quiver, And then, kind of as I was going through med school, a new class of medications came out that dilated blood vessels.
Okay.
And that didn't make any sense to a lot of people because the blood pressure often would already be low, so why would you dilate blood vessels and make it lower? But what would happen is if you have a weak pump, you can make that pump more efficient by decreasing the pressure against which it pumps out.
Yes.
Right.
Yeah.
So that actually, those medicines worked, and those were called ACE inhibitors, and they end with the last letters pril, lisinopril being one of the most common ones. There were other medicines, digoxin was one of them, that was thought to be helpful because it supposedly made the heart pump stronger. As it turns out, that doesn't help at all. Interestingly, when I was in training, if a doctor gave a patient a medicine called a beta blocker, which decreases the adrenaline effect on the heart, if you gave that to somebody with heart failure, back in those days, that was malpractice.
Wow.
As it turns out, that's the best thing you can give them.
Yeah.
So you need to study things, and things that seem like they should be sometimes are not so.
Yeah.
So you need to study them. And so beta blockers are one of the cornerstones of heart failure management. ACE inhibitor drugs were one of the cornerstones until fairly recently. And there is a newer class of drugs that only has there's only one. You've probably seen it advertised, Entresto.
Yeah.
It is clearly better than ACE inhibitors and angiotensin receptor. It has an angiotensin receptor antagonist in it, but that medicine clearly is a game changer.
What's the makeup of it?
It's got a cousin of the prils, called angiotensin receptor antagonist, the sartans. So it's got one of those, and the other one is I'm not going to pronounce it correctly, but there's another medicine that seems to be a game changer. There's something else.
Wow.
The next thing, so I mentioned the term angiotensin, which is a hormone that your body makes in response to low blood pressure or the need to retain salt, called angiotensin, and that is a whole sort of cascade of hormones that are in your kidneys, and that makes you retain sodium and water and these kind of things. There's a blocker of that series of hormones called spironolactone. That is another one of the pillars, clearly a big deal. So that's 3 of the 4 pillars. The last one is a surprise. So there are legions of new diabetes medicines out there, and
there's a lot.
I couldn't even hope to manage diabetes anymore, but some of them have been found to cause weight loss. So Wegovy and Ozempic and these things are very, very people are very excited about them.
All over the internet.
But one of the other new diabetic medicines, it's called SGLT2 inhibitors, or SGLT inhibitors. There's 3 of them, Jardiance, Farxiga, and Impefa, that are also, for some reason, fantastic heart failure medicines.
Really?
Yes. And in fact, the diabetes medicines are considered first line. Wow. And I will tell you that getting people on those 4 medicines, very often they can come off the diuretics. They don't even need them.
Really? Interesting.
It's insane. Seriously, I mean, a heart failure patient not needing furosemide, you're kidding me.
Wow.
Not just does it look like it treats their symptoms, but now their heart gets stronger.
Stronger.
And in a few months, you go back and look, and their heart's back to normal. Yeah.
Man.
So it's created a whole new class of patients that's recovered heart failure patients.
Quicker, yeah.
Recovered. So now we have to figure out, well, do you continue all these medicines? Do you need to? Which ones? Do you need them all? Do you take them forever? Can you cut the doses back?
Wow.
And
that's pretty cool.
That requires study.
That's pretty cool.
It is amazing.
I didn't even know that. Wow.
Well, this is congestive heart failure is the most common discharge diagnosis for the hospital. It's the most common reason why people end up back in the hospital.
Yeah.
So fixing heart failure, or at least making it better,
is a big deal.
Wow. And I do think this is super much a team approach. I mean, I think your home health services is enormous.
Educating all of our nurses,
dietitian, dietary things,
endocrinologists,
exercise, getting your medicines, getting follow-up, having somebody to call, because sometimes, when you're starting to get into trouble, if you have a professional looking at you and you say, you're getting in trouble, let's get you treated now.
Quicker,
then you prevent falling off the cliff and ended up in the hospital.
Wow.
Yeah.
Yeah, this is some good Easter eggs just for me, if anything. This is really cool.
It's huge. It's huge. Huge. This is, I'm hopeful that we will get to a point where there's different companies trying to sell remote patient monitoring.
Yeah.
I think the very best remote patient monitor is a nurse.
100%.
So, remote patient.
You say that one more time to the camera.
Well, the best remote patient monitor is a nurse.
Yeah, 100%.
If you have a internet connected scale and an internet connected, oxygen sat monitor or blood pressure cuff, all that can be replaced 10 times better by a nurse who cares about you and can look at other things and That's
Yeah.
that's
And now with AI trying to come in, it's
these things have their place. I'm certain.
true.
They're certain of
yeah,
it.
yeah.
But
There's no comparison. Yeah.
no.
Yeah.
Yeah, you have a well-trained, thoughtful, caring nurse that knows something about you. Dude, that's gold.
That's awesome.
That's gold.
One more diagnosis. So that was really great, because I think a lot of families, patients, kind of needing to understand the syndrome of
Yes,
CHF.
for sure.
Next one is CAD. Right.
Okay.
So if you can break that down
For sure.
specifically.
So the term coronary artery disease refers to cholesterol plaque, atherosclerosis, hardening of the arteries, whatever you want to call it. They're all the same thing. That occurs in the arteries that supply blood to the heart. So the heart is a muscle. Muscles need blood flow to be able to work. They need fuel and oxygen. They need, they need energy producing molecules and oxygen. So there's 3 big arteries that supply blood to the heart, and those 3 arteries are prone to accumulating cholesterol plaque. The risk factors for cholesterol plaque anywhere, but certainly in the heart, there's 7 things. So age over, say, 50 or 55. There's some thought that males are slightly at increased risk. I don't think that's really true. I think it's just as common. I think it is close to as common in women. But so age, sex, high blood pressure, high cholesterol, diabetes, family history, smoking history.
All 7. Yeah.
Yeah, so there's 7. So some of those things can be modified. Some of those things can't be modified. So we modify the ones we can modify. We call them risk factors because they're not causes. So everybody knows the 90-year-old smoking, drinking guy who has eaten poorly and never exercises.
And he's doing great.
He's doing great.
Glass of whiskey every day.
Right.
I'm like, what?
We all know that guy. And we all know the guy who keeled over dead at age 43.
Yeah. And it was healthy, isn't it?
Yeah, that's right. So I have a story. The poster boy for this, for me, was a guy he was a marathon runner. In fact, he worked for the Olympic Committee. So and at the time I met him, he was the NCAA clearinghouse.
Oh, wow.
So people wanting to play sports in the NCAA, it was him.
Wow.
He was the clearinghouse.
Wow.
So he was very healthy guy. His only risk factor was that he was a guy. No past medical
Nothing out of the
history,
7.
no family history, no nothing. He came to my attention because he was running a marathon, and at mile 17 or something started having discomfort in his chest. So he came to see me for the first time, and I thought, oh boy, so we're going to put you on a treadmill, and I'm going to need to call the company to service the treadmill because you're going to wear it
Break
out.
it out. Yeah.
And he about did.
Wow.
So he got on that treadmill. I needed to get a sandwich because he was on that treadmill a long time. He was trying to wear my treadmill out. But sure enough, on, about 18 minutes into his treadmill test, which nobody goes 18 minutes.
Wow.
Nobody. He said, I'm starting to get that discomfort. You look at his EKG and it's like, you look like you're going to die.
Wow.
So we stopped this thing. I take him to do a heart catheterization. He needed bypass surgery. No risk factors.
What?
So we call them risk factors, and that's what they are. They're not causes. So the more risk factors you accumulate, the higher your risk. But that's it.
Wow.
So,
and for that, it's like, how would he have known?
well, at least he paid attention to himself. Yeah. So, so that is the condition that the most common symptoms of it are pain in the chest or shortness of breath with activity. Most common. Actually, the most common is nothing. It is detected. Sometimes an EKG can point you to it. a stress test can usually be helpful. An angiogram, so heart catheterization like we talked about before, can be done also with a CAT scan, often not quite as good as a catheter angiogram, but it has its utility. Another tool that has actually been around for a while, it's pretty cool, pretty slick. So cholesterol plaque is hard to visualize in the body and without cutting up the tissue and looking at it under a microscope. And for the heart, that's kind of a rough test.
Side note, did you guys have to do cadavers?
Oh, yes.
Man, I loved it. I loved it. It was my favorite. Cutting open the heart.
Yeah, right.
It was so fun. Sorry, I had to
that's
just reminded me of that.
So we've done all sorts of things over the years as a surrogate, to look for blockages in the heart, and that's stress tests and heart catheterizations and whatever. But as it turns, so the problem is the heart arteries are tiny, and they're in the middle of you, and the heart has this nasty habit of moving around about 80 times a minute. So it's difficult to interrogate. So fortunately, one of the features of a cholesterol plaque, we'll put it that way, is that it will take on calcium. So a cholesterol plaque that's been there for any length of time will have calcification in it. And the more calcium that's there, the more plaque there is. So calcium we can detect, right? You put your hand up in an x-ray machine, you can see the bones.
Yeah.
So a CAT scanner is nothing more than a fancy x-ray machine hooked up to a computer. So a smart person decided, the trouble is the heart moves though, right?
Yeah,
so if you just do a CAT scan of the heart, it just looks like a blob.
Yeah, you can't see it, yeah.
Well, if you trigger it to flash the picture by your EKG, then you freeze the heart's motion like a strobe light. And now you can trace along where the heart arteries are. And if you see calcification, there's cholesterol plaque. So that is a very useful tool.
Wow.
And
you do that a lot? Is that
we do it a lot. And actually, people have CAT scanners, they're kind of selling them now. Insurance doesn't pay for these. But they're about $100, sometimes a little less.
That's worth it. Some save your life.
Absolutely. So, there are some people who read into that number, the calcium score, a lot. For me, it's more, is there any there or not? And is it a whole lot or kind of just a little bit? And so I don't think the number is as important as kind of the, high, medium, low, kind of thing, or is none. But it's a pretty helpful tool, and can help guide, I think, decisions to do certain kinds of stress tests or angiograms or whatever. And certainly can help convince people that, yes, you really do need to take your cholesterol medicine.
Yes, especially if
really
you have more of those risk factors like you were saying.
Yes, and maybe you really do need to quit smoking, and yes, you really probably need to get your diabetes under better control, and that kind of thing.
Wow. Man, that's crazy.
You get no more questions.
right?
I don't know. I was thinking, is there any vitamins I should be taking for my heart?
No.
No? Okay.
So this, there have been times in the past where, vitamins were thought, different vitamins, antioxidants were thought to be a good thing. So they have really kind of honestly been disproven as helpful. The one vitamin that has some utility is niacin, because it does alter the cholesterol values and actually does help outcomes, probably more so than any, it's actually, if you could get a person on the enough niacin, it seems like it would be the perfect cholesterol medicine. It changes all the cholesterol numbers in the best way.
Wow.
The trouble is very few people can get on enough of it to matter, because it causes horrible flushing. It's like a hot flash. And there's different ways to mitigate that, but truly, we have statin drugs. That's the juice.
Yeah, because I see like a whole thing on social media. It's like, you need to take this vitamin, and I'm like, what vitamins do I need to take?
Yeah.
Fish oil is also a reasonable supplement to take, again, but if you need a cholesterol medicine, take one. And the statin drugs are the most vilified and studied medicines in the history of medicines. There's not 10,000 patients in trials about statins. There's hundreds of millions of patients in trials about statins. They have been scrutinized more than any other drugs.
Wow.
The number of people who train to do heart surgery has been slashed by the presence of statin drugs.
Wow.
They have changed medicine.
That's amazing.
They are really something else. Yes, there are side effects, and about 5% of people have them, and it's typically muscle aches. But all this other stuff that people have talked about that statins cause are either not well established or been disproven or whatever. They are really something. So for sure, some people can't take them. There are some alternatives, fortunately, these days. But going out to, your grocery store, to the vitamin aisle to take something that's going to help, I'm not going to tell you not to do it. It's probably not going to hurt you. But if you want to make a positive step to help yourself out, go to your doctor, get your blood pressure checked, get your cholesterol checked, pay attention to yourself, get some exercise, don't smoke. Seriously, just snacking down a vitamin is not the answer.
Do you have any underrated foods or activities that are really good for your heart? Or that are easier to eat than others?
Yeah, it's once again, so back in the day before there were really good cholesterol medicines, people did analyze diet a little bit. Not a bunch, actually. I mean, the food pyramid and all these things you hear about, honestly, even those things are not usually terribly well studied. There was a diet called the Ornish diet back in the day that was basically, eating cabbage and carrots and whatnot. The number of people that could follow that to significantly change their cholesterol was very small, and vanishingly few people actually change their cholesterol numbers, much less their risk. I don't think there's really been a clear. If people have high blood pressure or heart failure, then avoiding salt and alcohol, that's pretty important. But for general heart health and all that, obviously not overdoing salt, not overdoing alcohol, curbing your fat intake. All those things are good, but for me to tell you, you should eat 3 beets a week and 2, and honestly,
Don't tell
I'm,
me
I'm,
that.
no, but I'm being disingenuous. If I try to tell you that there is a diet you should follow, if you're diabetic, you should follow a diabetic diet. If you have high blood pressure, following a salt modified diet is a pretty good idea. The DASH diet, for example.
DASH,
And I don't think that a medicine gives you license to misbehave in a dietary perspective. So if you have high cholesterol, you start on a cholesterol medicine. That doesn't mean that you eat a half a gallon of ice cream every day. It means that things work together, and if you're sensible about your diet, that's probably good enough.
That's a good point. Wow.
But eating is one of the joys of life, right? If you're not going to live, you might as well die, right? So I think being sensible about your diet, however, is good. Can you eat a cheeseburger? Yes. Can you eat a cheeseburger 3 days a week? No.
Like a good balance.
Yeah.
That's right.
Got it.
If you're going to go get pizza with your family, order a salad, have 1 piece of pizza rather than 3 pieces of pizza. As an example.
That's really
Be
good.
sensible.
That's a good question. That's good. Hey. This is great. Any other thoughts regarding just different diagnoses for the heart that you've kind of seen just in your experience?
We could do this till next Thursday. I mean, that'd be very easy to do.
Yeah.
Without sleeping or anything.
Yeah.
I nothing in particular, unless you feel like there's something.
Yeah, those are the big ones.
Okay.
I think those are the big ones that we like, and we see also a lot.
For sure.
Because those 2 main ones, a lot of questions with families on those specific ones.
For sure.
Right, and then how do you make sure not just the family, but I think a lot of times it's it takes a village, right? It's the patient and the daughter and the son and the right, everyone kind of coming together and saying,
sure.
like, how can we help? And I think that's the biggest thing. So
For sure.
yeah.
For sure.
Awesome. Good. This was good.
Good.
Man, thank you so much.
Of course. Yeah, my pleasure.
Is there any way that people can reach you? What is the best way for, if anyone is in the Dallas Metroplex, what are some best
Sure.
ways?
So heartplace.com is a place where you can get all of our phone numbers and whatnot. Cool. That's the first place to look for sure. My office is in Richardson, on Renner Road, so that's the place where you find me particularly. Cool. But I actually have dozens of really good partners, and I feel like we're pretty evidence-based and patient-centric, and I think we're pretty. I don't think that I'm unique in Heartplace. You know what I mean?
Yeah.
So I think there are plenty of good people to see, if you need it in our group.
Awesome. Well, thank you so much. Appreciate you hanging out with us. We'll do this
Oh,
again.
it's a pleasure.
Awesome. We'll see you guys.
Right. Thank you for watching this episode of Charlin Care Pods. You can find Dr. Rick Ammar at www.heartplace.com and search Rick Ammar. Thank you so much. See you guys soon. Don't forget to like and subscribe.